Hey YouTube! Today I'm going to tell you everything I can think of to say about focused shockwave therapy for chronic pain. If you don't know who I am, my name is Cassie Haney and I am one of the co-owners at Impact Laser Therapy and Wellness in Amarillo, Texas. And we specialize in non-invasive pain treatments. Our two top modalities are our Class 4 laser and our focused shockwave. So I just want to give some basic information about when to use the shockwave, how to use the shockwave, and what you can expect at your treatment. So shockwave therapy was actually developed. It's interesting because it really is just sound waves that are put out through a handpiece. You can see the handpiece is right there. Whenever you turn this machine on and you start to use it, you'll hear a clicking sound and it sounds like, and there's a little mechanical arm inside of that handpiece and it basically pounds out these sound waves that put a disturbance through your body. So the way that it works is the shockwave was developed because they were using really high focus sound waves to break up kidney stones and gallstones and things like that in the body, and they could target and hit the specific spot they wanted to hit whenever they were doing that. And what they found was, even though they could get real specific on one spot to break up those stones, the residual area around the stone, they noticed that there was a lot of improvement in pain and function. And it was like somebody who had low back pain, you know, they would go through and work on that kidney stone, and then that person would say, you know, my back pain has gotten better or gone down or gone away. And so what they did was they created this machine that doesn't have that central, sharp, really focused, super focused sound wave going for the kidney stone. This machine has the residual effect. That's all it is the residual effect from the other machine. And so this machine sends sound waves through the body. And what these sound waves do is whenever these waves go through healthy tissue where there's no issue, no problem, everything is great, the sound waves just kind of go through the same way, like the same way an ocean wave. If you're in the ocean, you know, and you're just floating there along and a wave comes by, you just roll with that wave, no problem. You're up, you're down, it's fine. But whenever these sound waves go through places where there's damage or an injury, they go through and it really triggers your nerves, because you really will feel like, you will be like, oh man, there it is, it's right there, I can totally feel it. And so some people use the shockwave as a diagnostic tool, because if you don't know where your problem is exactly, this machine has no problem telling you exactly where your issue is. And a lot of times it's not uncommon at all for somebody to come in and say, you know, it kind of hurts over here in this area, but then whenever we put the shockwave on it, that's not the spot where it's telling us the problem is. It means that they're having referred pain and the actual issue is somewhere else. And so that helps us be more direct whenever we are doing our laser treatments as well. So the shockwave works the best on tendons and ligaments. So if you have any kind of tendon or ligament problem, the shockwave is just outstanding in treating that issue. So I'll give you a few examples of some injuries that we've treated in the past that have done really, really well. So we had one client who came in who was a CrossFitter. And I guess if you do CrossFit, I haven't really done CrossFit, even though I would like to do CrossFit. But I guess there's some workout they do where they're kind of like, I don't know, up on a peg wall or something, and you're kind of up on that wall and hanging on that wall. And whenever he would be up on that wall or holding his body weight up, holding onto that peg, he would get a pain in his forearm right here. And it was this insidious pain right there in his forearm. And anytime, it usually didn't bother him. Sometimes it would bother him here and there, but every time he did that one move in CrossFit, oh my gosh, it would just light up, it would burn, it would hurt. So he came in for 3 treatments. He did a shockwave and laser combination, and he did them a week apart from each other. And every time he got better, and now his forearm doesn't hurt anymore. So each time it was an improvement, and now his forearm just doesn't hurt anymore. I had another lady who had so much tension in her upper back. So she is a dog groomer, and she had been coming and getting laser every single week for a long time because the laser was helping her with her tension headaches. So she just had so much tightness and tension in her neck and upper back, and the laser alone cut those headaches out. After she started lasering, you know, she would have at least 1 or 2 tension migraine headaches a week. And as soon as she started lasering, those tension headaches were gone. But she still had a lot of tightness. And she said, you know, whenever I'm grooming a dog, I gotta hold the dog really tight by the leash up here, and then I'm over here with the dryer over here, and it's just a lot of this same monotonous, repetitive movement, and it was just locking her down around her upper neck. So I said, you know, we've been lasering, the laser has done you a lot of good, but let's just put the Shockwave on you and see what happens. And that Shockwave was able to go in there and break up that knot that she had in her upper back. And her pain went down drastically. And so now when she comes in, she lives out of town. So when she was getting laser every week, it was because we went to Pampa, where she lives. We had been going there every single week. But when we didn't continue on with that program that we had, she had to come to Amarillo. And that's another thing that's really good about the Shockwave is, like with the laser, you have to come in for your treatments regularly. Those treatments, they come in a package, they're built together, and you need to get them all in within a 2 to 3 week time period. With the Shockwave, it's completely different in nature because it breaks things up. It's an agitator, a disturber. It breaks everything up, it causes a disturbance, and it puts your body into a healing cycle. And so you have to, after one session, really give your body time to heal and recover from that session before you do your next session. And so it's not like, okay, I did one today, I need to see you again this week, and then I need to see you twice next week and twice the week after that. This is more like, let's do the one, and 7 to 10 days later, you can come back in for your second one, or longer. It's not as strict as the timing with the laser is. I have another client who's done really well with the laser on their shoulder. A lot of shoulder issues can be so complicated, but you have so many, you know, tiny little muscles and tendons and ligaments in your shoulder. And sometimes if just one of those is compromised, it can really affect what you're able to do with your arm. Can you lift it? Can you lower it? Can you put it through its range of motion? And the Shockwave has done amazing things with shoulder rehab. A lot of people who really don't want to have that shoulder surgery, you know, they're like, oh, I've seen it, I don't want to have to sleep with the thing and wear the deal and have it on and be in this, you know, whole get up for however many weeks, and they don't want to do any of that. Oftentimes the Shockwave is just the ticket to get them to heal and affect some kind of a change in that area. Another area that we have great result with the Shockwave is the knee, especially chronic knee pain, where it's like, my mom is a good example of this. My mom was having knee pain, and if it would get exacerbated when she would go up the stairs. And so there was one day after Christmas that she keeps all of her Christmas decorations. My mom is a decorator, and you should see her house at Christmas time. It looks amazing. But she has a lot of decorations to take up and down stairs at the beginning of the season and the end of the season. Well, this Christmas, after the season was over, she had been going up and down the stairs, taking decorations back down to the closet where she keeps her decorations. And the next day, her knee was just killing her. She was limping. It was just giving her all kinds of problems. For her, it was right on the inside of her knee, just past the kneecap on the inside. And she was really struggling. And I said, Mom, why don't you come in and just let me treat your knee with the Shockwave? And, you know, sure enough, about 4 sessions of Shockwave treatment, and she's walking, her knee's not bothering her anymore, and she's doing much better. We also have good results on the Shockwave with neuropathy, which is just fascinating to me. But we have people who have neuropathy in their hands or their feet, and they will get Shockwave treatments, and they can't believe how good they feel. Also, I have a client who's got an ankle issue, and the Shockwave is really helping him get through this chronic ankle problem that he's had. So all that to say, the Shockwave is really, really good if you have a chronic injury, a chronic problem. Where the laser is great if you have an acute issue. If you have an acute problem, we'll just shine the laser on that and push you through the healing process and get you over that injury, take away your pain and inflammation, and you'll be doing great. But we want to bring the Shockwave in, combined with the laser, whenever the problem is chronic. So let me just dive into that a little bit more. I like to use this analogy. So if you had a closet in your house and you had a group of friends call and say, hey, we're driving through town, do you mind if we come and spend a few hours at your house this afternoon and take a little break from driving before we get back on the road? And you're like, oh yeah, of course, but what if your house is a mess? And so you go through your main living areas and you gather everything up and you put it all in the hallway closet. And so your house looks nice, everything's fine, you're ready for your company to come, but in the back of your mind, there is a huge mess in your hallway closet that you're gonna have to get to. That's kind of how I think about chronic pain. It's like something happened. There was an injury. There was some event that happened somewhere on your body, whether it was your low back or your knee or your neck or your foot or whatever it is. And your body knew that there was a problem, and it went around real quick and tried to just do the best job it could at the time, to be able to just kind of handle it the best that it could. And then whenever daily life came into play, it had to focus its energy back on company that was over, and then it was mealtime, and then you got kids, or you got whatever was going on, you got to go to work, you got to go here or there, whatever. And that patch job that you did by just throwing everything in the closet is still just a patch job, and things really aren't in place. They're not in order. They're not the way that they really should be. So the Shockwave is kind of this is the analogy. If I was the Shockwave, I would come to your house and I would open up that closet and I would just very gently pull everything out onto the floor, out of the closet. And that would force you to have to deal with this problem that you created whenever you didn't, tidy up the right way the first time. And so basically what I would do is just pull everything out on the floor, and you would have to go through and say, okay, here's all this stuff. Let's make a pile for Goodwill. We'll make a trash pile, and then this pile we'll put up where it goes. And so the idea is that after we do that a few times, you might kind of say, okay, we're just going to put this back in the closet, but these things we'll throw away, and these things we'll put away. Well, then if I came back 10 days later and I opened that closet again and I pulled out the things that were out of order again and I put them on the floor, and you were like, oh my gosh, okay, so I'm going to organize this stuff right here and set it in this place, and then I'll throw this away, and I'll put these things in the other room where they belong. Well, every time we went through that process, your closet's going to get a little bit nicer and a little bit neater each time. And that's exactly what the Shockwave does. It goes through and it causes a disturbance, and that disturbance is inflammatory in nature, but what it does is it forces your body to address the issue that it has been avoiding. And whenever you combine that Shockwave treatment with a laser treatment, you shake everything up with the Shockwave, and then you turn around and you bring in the laser and all of its healing light and healing energy, and it pushes you through that recovery phase. After you've shaken it all up with the Shockwave, we get amazing results for chronic pain and chronic problems. So if you're interested in checking out the Shockwave, we can combine a Shockwave treatment with the free laser trial that we like to give out to as many people as we can. And so for a good price, you could get both, and you could see how you did. I will make another video that is just commonly asked questions about the Shockwave, but today I just kind of wanted to give a brief overview. So I hope you have a great day.